Thank you for a chance to present our study. Today I would like to present about Hallux Interphalangeal Arthrodesis following first Metatarsophalangeal Arthrodesis. I have nothing to disclose. Background. Hallux Interphalangeal Arthritis can occur after Metatarsophalangeal Arthrodesis. IP arthrodesis is a standard treatment for arthritis, deformity, and severe trauma of Hallux interphalangeal joint. But in the setting of prior metatarsophalangeal surgery, there will be increased stress on IP joint. So this may result in diminished potential for bone healing. Union rate for Hallux IP arthrodesis range from 56 to 100%. There are no reported radiographic outcome study of IP arthrodesis after the first MTP arthrodesis. This investigation seeks to assess the outcome of Hallux IP arthrodesis after the first metatarsophalangeal joint. So we hypothesize that there would be a lower union rate, higher complication rate, and a longer union time comparing to an isolated IP arthrodesis. Method. After institutional review board approval, we retrospectively review medical records and radiographs. Patients who underwent Hallux IP arthrodesis at our institution between 2007 and 2017. All procedure was performed by an experienced foot and ankle surgeon. Indication for surgery was the painful IP arthritis with failed conservative treatment. Method. Inclusion criterion was Hallux IP arthrodesis in the patients over the age of 18 years. Exclusion criteria were bilateral surgeries, revision surgery, previous infection, and the post-operative follow-up time less than 12 weeks. We compare the patients with and without first MTP arthrodesis. There were 42 patients whose median follow-up time was 9 months. The median time from previous first MTP arthrodesis until IP arthrodesis was 54 months, or it's about 4 years and a half. For the patient's characteristics, there were 17 cases who had a prior ipsilateral first MTP arthrodesis and 25 cases who had an isolated IP arthrodesis. There were 3 differences in patient's characteristics, which is the patient with IP arthrodesis following ipsilateral first MTP arthrodesis were older and had rheumatoid arthritis. Most of them were female. These are the radiographs of interphalangeal non-union with previous ipsilateral first MTP arthrodesis. 35% of patients with prior first MTP arthrodesis had non-union, but only 8% occur in the isolated IP arthrodesis. This is significant, and prior first MTP arthrodesis also was more likely to have complications, 53% versus 24% respectively. Considering only that cases that were classified as a successful union, time to union was 13 weeks and 10 weeks respectively. Multivariable regression were adjusted for 3 different characteristics, which is age, sex, and rheumatoid arthritis. With the multivariable risk difference of non-union was 53% with a statistically significant. The multivariable risk difference of complication was 35%. P-value was 0.082. Post-hoc power analysis was 35%. This underpower means that the difference in the risk of complication may be statistically significant if the sample size was larger. Discussion. The speed of bone union was also statistically significant with a multivariable rate ratio of 0.21. Discussion. IP arthritis progressed in up to 2/3 of the patients after a first MTP arthrodesis. Most patients with progression of IP arthritis were asymptomatic, so we found only 17 cases that went on to require IP arthrodesis. The complication of IP arthrodesis following prior ipsilateral first MTP arthrodesis were not noted to be more statistically significant than in the isolated IP arthrodesis group, with the exception of the non-union. So non-union demonstrate a statistically significant difference between the 2 groups. This implies that the most likely complication discrepancy between the groups was non-union. So, and furthermore, there's 23% infection in the first group and 12% infection in the second group. 2 patients in the first group eventually needed amputation. So this shows that the result is not really good. I search for the paper, there's a case report of serial bilateral IP fusion with one screw and interpositional arthroplasty of the MTP joint with a semitendinosus tendon. The patient was reported to be satisfactory with a procedure without pain and walking 6 kilometers a day at 3 years after the initial surgery. Nevertheless, the follow-up time was still short. This procedure can lead to a floppy toe, cock-up deformity, push-off weakness, transfer metatarsalgia, and stiffness. A major strength of our study is that, to our knowledge, this is the first report on the outcome of the IP arthrodesis following the first MTP arthrodesis. One limitation of the study is its retrospective nature. And furthermore, despite a long collection time frame, our sample size was limited. Therefore, post-hoc power analysis were unable to prove the statistical significance of some observed data. A larger, longer-term prospective randomized control trial is required to determine the best treatment algorithm for these patients. In conclusion, prior first MTP arthrodesis increased the risk of non-union, risk of other complications, and slower the rate of bone healing of IP arthrodesis. The number needed to harm was 2 patients for non-union and 3 patients for any other complications. It resulted in almost 5 times lower bone healing. Thank you.